Hi, welcome everyone. Today's presentation is going to be about records for full arch. With us, it's specifically for Chrome GuidedSMILE. You might ask, why? Why now, after all these years, are we doing a presentation on Chrome records? The main reason is this first slide, which is 7 out of 10 cases go on hold when the records are uploaded for some reason. So 70% of our records, which means that 70% of the records are delayed. They're not meeting what we would like to have as a time requirements. And we can help with these records. And I'm going to go through this whole program today, about an hour. We're going to go through the records, how to capture them, how to upload them, how to verify them, and then maybe even more importantly, how to triage, how to work with the records with different types of situations, and then to make sure that you have every record that we need before you upload, so cases don't go on hold. I made this friendly slide, but I was going to start with this one, but I thought that's not very nice, very intimidating. But it's 7 out of 10, and that's pretty consistent, for years, and which really kind of goes against what we would love to promise, and that is a time frame from the time you hit submit until you have the case back in your office. And we would like that to be somewhere around 20 days, right? 20 working days. Now that's 4 weeks. We'd like to make it faster. We found that if all the records are right, we're at about 20 days. Some of those delays are getting online for the online meeting. So if you just look through this wheel here, you can see that if the records are sent in, all the records are correct, submitted, accepted, then it's about 5 days until you are in about 6 days until you're in your online meeting. So 5 days for the workup, the case analysis, for us to send an email out to you with a little bit of a buffer to get online. But somewhere between days 6, 7, and 8, in that time frame, we're online planning the case. And then once we hang up, that's when we ask you to schedule your surgery, because we just hate to have those annoyances, anesthesia or patient appointments, that kind of thing, being disrupted because of records or delays. So you'd schedule your appointment. You can see down here, attend online meeting at about 5 o'clock there, and then schedule the meeting. And then we very predictably fabricate and ship when that last 10 days is all ours, and then a couple days to ship, or overnight if you need. So our goal is to meet this, and the one way to meet it is to go through today's meeting, because this really is the holdup of all these cases. So we hold cases up for a number of reasons. Bite questions, that's usually the number one. Restoring vertical, most of these patients are compromised, so the bite needs to be opened. We'll call it bite opening, but really we're restoring vertical. That's really the main way to talk about it, because a lot of it is face, smile, lip exposure, gums, teeth, space, prosthetic space, all these different things have to do with restoring vertical. Land area is missing, which means either models or CBCTs that are cropped. You can see CBCTs also on here. Space requirements for prosthetics, often that comes up for a discussion. Denture tissue gap from a dual scan, and then just basic incomplete records. These are all the reasons these cases go on hold, but initially just for records. What we're going to do today is we're going to talk about three different types of patient situations, and we'll cover the last one just briefly. It's just a couple of slides. The first one is the most common, dentate patient. These are the pain patients. These are the patients that need a solution right away, even though maybe they've been living with it for a long time. Edentulous patients are not pain patients, so they're much less common than dentate, and dentate often cause the biggest bite issues. With dentures, you've kind of worked out the space, the vertical, and everything already in a denture for the most part. But the dentate, those are the trickies. So our laboratory, our team here has put together some incredible resources for the dental team. And I'm going to share how to get to these resources, all about records. So just as one here is our FAQ. And our FAQ is just found on the Chrome GS page here, and you'll scroll down to it's in the FAQ part of our website. Forgive me. And on here we have a lot of the things we're going to talk about, and this would be a place for you to ask questions and find the answers on your own on our website. So that's a very helpful FAQ. There's also Records Concierge, and we just developed this recently. We have a team here at our laboratory who can meet with you online, live, while you turn a camera on your cell phone or on an iPad or even on your computer. Sometimes it's just best to pull out your phone, join us online, and use your camera to show us the records that you're collecting. Because often what happens is the records are collected, and then there's questions. Patient's dismissed. Patient drives an hour, 2 hours away, and they have to come back in for something probably pretty simple that could have been captured while they're still there. So what we ask is that you schedule an appointment. When you know a patient's coming in for Chrome records, schedule an appointment. You'll simply click on, for instance, join Brittany, and that will that will allow you to join an instant meeting. Turn your camera on. We'll turn our iPad on or our computer, and we'll see exactly what you're seeing. Show us your CT scan. Show us the digital impressions that you captured. Show us your PVS impressions. Show us what you're going to export. Show us the photographs you took. So instantly, while the patient is in the chair or out in the waiting room, verify your records. Very, very helpful way to ensure that the records are coming over properly. And then, just as important, we have built a whole web page that has a place for you to find checklists. We have made a checklist for just about every single type of patient situation that comes in the door. So just as an example, single dentate arch with opposing dentate, the most common. This is our checklist right here. And it has check marks on it. You would print this piece of paper, print it, and as you're collecting records, check them off. You have everything you need, and then upload. And it will give you tips on photographs, on the records, on the STL files, or the PVS impressions for landmarks. It will talk about dual scan if it's an edentulous, and what to look for. And if you will use these checklists, you'll be very, very far along in the process, and we should be at go time when you upload. So let's go into the Chrome records for a dentate case. The records are very straightforward. They're general dentistry. They're photographs, upper and lower cast with a bite or digital impressions. About half our cases now are digital impressions, and a CT scan with the teeth apart. So at a glance, you'd say, well, that's pretty simple. Why is it 7 out of 10? Well, let's go through why. This is a dentate package. On the right are the 3 intraoral photographs that we want. Left, right, center, and then one left, right, center, and retracted in occlusion. Teeth carefully put together as a patient normally bites, as the impression is. That's what we want to see on the screen when we are making sure that our mounting is correct. We want a full face, full smile picture. I'd like to see a little bit more smile, and a lot of patients in these situations haven't smiled in years. It's tough to get them to smile. But if you can work really hard, try to get them to smile, because what we really want to see is tooth exposure, gum exposure. We want to see where the necks of the teeth or the incisal edge of the teeth, how they work with the upper lip, because this is very important for determining bone reduction and smile design. Really important. And then a CBCT scan, you can see this is the dentate patient, right? So we always have the teeth apart, and we'll talk a little bit about that detail. And then complete, complete casts, right, with all the land areas. So this is just at a glance what a dentate case would look like. We're going to go into the details. The photographs. I've always shown this screen, this image with an SLR camera, but a lot of cases are not as such. So I have another slide after this that shows a different way to take photos. But these are the basic photos, and we do add the two on the right for if a patient has lip support issues, if they're severe class 2, severe class 3, and we really need to understand where the teeth need to be, to maybe fix some issues with the profile. But left, right, center, and then with the camera positioned with the lens right in the middle of the nose, take a picture. At its simplest, I could just leave it at that. I can give a lot more tips on photos. One is you can see the red line in the middle of the nose. We want the lens at the level of the nose, not high or low, right in the middle. This shares with us the plane of occlusion very well. And it also shares the smile, the eyes, the face. We can get the whole face in the right position. And then one little trick is you can make sure that you can see the left and right ear about the same size. And then you can even see in our example here, the patient's looking a little bit to the left, right? You can see more of the right ear. And the reason we want this photo is because we develop some beautiful smile simulations. And really the only way to make a ideal perfect smile simulation is to start with a great photograph. So those are the photographs. If you're using an iPhone, and that's the nature of the business right now, you're going to pull out your iPhone and take some pictures, works great. Please don't put it in portrait mode. Portrait mode fades out the background and the foreground, and therefore the posterior teeth may not be an occlusion for your close-ups. I definitely recommend an add-on. You can Google all these different extra lights and cameras and little lenses you can put on the camera. $30, $50, very inexpensive, but it really helps with depth of field, and it helps with flooding the mouth with light so that we can see the teeth really well. And one thing to remember with a phone is that the camera is up at the top, right? So you want to position the lens of the camera right on the nose, at the level of the nose. That's often an issue because the world is used to doing selfies, and they do it from all different positions. These are obviously not very good selfies, but normally pictures that you would see, they're not straight on at all. They're from all different angles, and it makes it really tough to do a smile simulation and really tough to do case analysis when we have photos from all over. These are some examples of pictures that really don't work. Top left, patient's eyes are closed and there's no teeth, right? So we don't want that picture. The one in the middle, it's really too far away. We like to zoom in, we like to crop, give a beautiful before and after. It's tough to analyze the teeth when you crop in and it's all pixelated. Both the top left, top right, well, top left and bottom left, both the patients are in the chair or lying back. And that just changes the face. It changes because of gravity. It changes the way the soft tissue is being pushed around the mouth. The gentleman on the right, the flash is really washed out. Now I'm being a little picky. We can make most of these work, but really ideal photographs are just a little bit of effort away. Bottom right, that picture won't serve much of a purpose for us. He just needs to be a little happier and try to get his smile a little higher. And I know it's impossible with some patients, but make the effort to make a nice full face, full smile picture. Here's an example. It's Dr. Kiefer up in Connecticut. Every time he sends us a case, it's just beautiful, perfect. And he has a photo room, but I've seen him take pictures just like this with the patient turned sideways, sit upright in the chair, eyes in the middle of the orbits, make a big smile, snap, relax your mouth and say, snap. That helps with the low lip line, and then a profile. So nice picture just like that. And you can capture this picture probably with a cell phone just about as good. Why do we want this nice photo? Because we make smile simulations. This one's okay. We've made I don't know, 5,000 of these smiles over the years. Probably double that, and they really do a beautiful job. But even if the picture is like this, patient has a tough time smiling, we do a smile simulation. We bring it into the software. We set teeth somewhat according to what we propose. It's not a one-to-one. A one-to-one is very difficult in this industry with a lovely smile photo that we're trying to share with the patient and then making into a perfect reality. So it's not always perfect, and we don't promise that. We don't want to, but we want to at least get close to shape, a little bit close to size, maybe buccal corridor, that type of thing. But then we make a setup, and then we follow that the best we can. And so that's why we want that really nice full face smile. We have a whole catalog of smiles that we can pick from. There's basically four different shapes. We can use these shapes to create the restorations. Patients love these befores and afters. Often we do it after the patient's already said yes. So that's why we always recommend that the doctor buys this preview software and does previews just on every single patient that might want cosmetic or full arch dentistry, or even dentures. These smile simulations, they take about 5 minutes. Preview does some great training. You can look them up, previewdental.com, contact them, and you will definitely be doing more dentistry with those befores and afters. So those are the full face, and then the retracted. With the retracted are very, very important to us because we put these pictures on a big screen on the right, and on the left we have your articulated cast. And then we are literally going back and forth, left to right, making sure that we have the case mounted correctly. We will look at this interaction here. How are the upper teeth and lower teeth coming together in the photo? How are they coming together on the articulator? Are they the same? Which one's right or wrong? And that always brings up questions. Okay, so those are the photographs.